Welcome to Cardiovascular Matters. Whether you are looking for answers for yourself or someone you love, we are here to give you the best information available. Each week, the founder of Cardiovascular Institute of the South, Dr. Craig Walker, and medical device sales veteran Terry Roberts discuss the causes, symptoms, treatment, and prevention of health-related issues stemming from cardiovascular disease. Now here's your hosts, Dr. Craig Walker and Terry Roberts.
Hey, welcome back, everyone, to Cardiovascular Matters. Believe it or not, we've got, this is number 18 for us. We've laid down 18 episodes, and I'd encourage everyone to go back. If you get a chance, go back and take a listen to some of them. We've got some really great feedback on a number of the podcasts. Those involving peripheral artery disease is certainly a very hot topic, along with some of the stuff we've done on varicose veins, and then also obesity. We've also spent some time in some men's health, and those were very well received. Today's podcast is what we're going to call a special edition, and I'm doing this really on behalf of Dr. Walker and his work. Just recently, under his leadership, his group was awarded a special award from the Global PAD Association, and they received the 2024 Impact Award for peripheral artery disease work. And Dr. Walker, congratulations on such a great honor. And also, I want to let everyone know we'll be dropping a link in the if you're listening to this on YouTube, you can actually see the award presentation that Dr. Walker received, and then he really goes into the mission of the practice and exactly how things got started, and how a cardiologist hailing out of South Louisiana becomes such a global impact on peripheral artery disease. Dr. Walker, tell us a little bit more about that award.
Well, this award was an award for limb salvage. And as you know, Terry, limb salvage or saving limbs in people who have blocked arteries to their legs, which is, of course, the leading cause of major amputations, has been a big focus of mine for years. So I'm a cardiologist, but I realized very early on that peripheral artery treatment has a big impact on the whole patient. Okay, to start with, I became interested because I had to first go through the legs or the arms in order to get to the heart to treat heart disease. But I realized it was so much more. When someone loses a leg, really and truly life expectancy falls down, but the quality of life falls tremendously. These are not young combat injuries where an amputation occurs and people can get prostheses and walk. These are older, sicker patients who, once their leg is cut off, often it's kind of a death sentence. They don't live as long. They often go straight to a nursing home, never to leave again. And for many years, I've made it my mission to try to improve the care of these patients, both with intervention, but also preventive measures that could help people avoid this. And as you well know, I mean, this has impacted a lot of people. Your own grandmother at some point.
Right.
Why don't you tell her story and why this was sort of important?
Yes, my family, my wife's grandmother, which would be, I guess, my grandmother-in-law, but she's my grandmother. Heavy smoker, grew up, lived in the country, and at that time, a lot of people smoked. Not so much anymore, but she was a smoker, and she had developed some pretty severe peripheral artery disease. She had gone to some physicians up in Arkansas and some big institutions, and basically the analysis was done, and they basically told her that she was going to need. She had already had I believe a bypass surgery at one point, and that was failing. And they told her that she was going to need a below the knee amputation. And we were, as a family, we were just absolutely rocked by that information. And I mean, she was still very, very active, and we just didn't want to see that happen. So, at that time, I was Dr. Walker's rep, and I had watched all the good work that he was doing. And, this is literally tracking back 25 years ago. And at that time, the equipment was not completely, established. As a matter of fact, Dr. Walker was doing some of the early studies. I mean, first in man type stent trials and things at that time. So, Craig, I remember the day I called you and you said, "Hey, if you can bring her down here, I will certainly, take a second look and we'll try to see if we can come up with something." And then I was real pleased when you came out and said that you not only did you think we could avoid that limb salvage, you could fix her, and off to the cath lab you went, and it was at a time when stents were not as readily available and with such a variety. But I remember you were able to take a coronary stent and actually get that to the position it needed in her leg at that time, and it saved her. And she kept that leg for an additional 8 years of her life, and still smoked like like a chimney. We could not get her to stop, but I would say that last half of her life, I mean, she was up walking and gardening and doing all the things with the grandkids on the day that she passed. And had we not done that, I believe it would have, like you said, I mean, once a person becomes more sedentary and they've already got the cards stacked against them in terms of lifestyle, it's not a good picture. So for me personally, it's impacted my family, and I want to thank you for stepping in and putting that work in. And what's really interesting as I watched your group is how you were such an advocate with industry about, hey, we need these wires, we need these types of stent, we need this type of equipment. I'm the end user of this stuff. You guys are the developer and manufacturers of it, and I can't tell you how many engineers that I brought into your practice to bring new novel devices and have you look at them and say yes or no, or here's what you could do better. It was really wonderful, and it was wonderful to watch you enjoy that. I mean, you really liked interfacing with industry because you knew, I believe, that's the way you get things done. If you want new tools, you gotta make those thoughts be known, and you certainly had a big role in that. I know with several companies that I work for.
Well, Terry, I obviously first am a human being, and as I look at patients who get amputated, I just find it to be a terribly devastating procedure, and sometimes it's necessary, of course,
Right. Yeah.
Extensive infection. But I must say, across the country, we have what I call an epidemic of amputation.
Right.
And I say that because many people are amputated and they really have options available for treatment that are effective. And I'm not speaking of one or two patients that this was the case. I'm speaking of thousands
Right.
of patients that I've treated over those years. Many patients who were told only option was either an above or a below the knee amputation. And the overwhelming majority of those using techniques, we were able to avoid those. Not 100%. I would
Right.
wish I could get there. I was not 100% successful in your grandmother or your grandmother-in-law.
Yeah.
I opened up the vessels. That was successful, but I couldn't get her to quit smoking.
No,
Of course,
no,
that's not.
no one could.
Certainly, that's the other part. And perhaps I was not convincing enough in how important it is to take care of oneself as well. But over the years, I've treated thousands and thousands of patients, and in fact, have gotten referrals from all over the world
Right.
to a little tiny town in South Louisiana. And we've applied some of these techniques. Of course, we've through our conference explained these new techniques, and these have been adopted really throughout the world. Many of the things that started here, and really, I think it's one of the great accomplishments I've had in my career. As I look and people say, Craig, tell me what you're most pleased with. Certainly the legs and lives saved. That's very important. That was my contract with my patients, and that's what I was hoping to be able to do. Secondly, were the people I've trained, the young physicians, the fellows who I watch go out throughout the United States and actually now throughout the world because a couple have gone to other countries. And I see them succeed. And it's like my children succeeding as I watch. That also has really been very fulfilling. And then finally, the success of our conference, New Cardiovascular Horizons, where people really come from all corners of the earth. Every year we give an award for who's traveled the furthest, and that's become a pretty competitive award with people coming in from many other countries, really very far. The last one to win it was New Zealand. Before
Wow.
that was Australia. Before that, Pakistan. But people coming in from really lots of different places to participate in the conference. But I think one of the things that we have that I feel particularly good about is helping to bring attention to peripheral arterial disease. This is very common. It's blocked leg arteries. It can be blocked in the iliac arteries, which are still in the abdomen. It can be blocked at the hip. It can be blocked between the hip and the knee, at the knee, below the knee, actually even below the ankle. And, historically, people paid little attention to this. First off, they didn't think it was as common as it is. Mary Yost has recently published that more than 27 million people in just the United States have significant peripheral arterial disease.
Right.
That makes it very common. In fact, perhaps more common than coronary artery disease. But there's another thing. Often people who can't walk, I tell people all the time, sick legs are never attached to healthy people.
Right.
If you can't walk 50 feet, even if you've got blocked heart arteries or other problems, you may not get the angina warning that you would have. And so I cannot tell you how many people in saving their limbs, actually their lives were saved because once we found these blockages, we did provocative tests, and these people had critical blockages in the coronary arteries that really no one had suspected before. So I think bringing attention to this disease and making it a disease that's not just involving the legs, but it is a global problem. A person with a new diagnosis of symptomatic peripheral arterial disease is actually more likely to die of a heart attack than a heart attack survivor. Yet historically, people didn't pay attention to the peripheral arterial disease in any way other than just say, well, let's fix the leg. We can't do just the leg. We've got to make this patient avoid other cardiovascular risk factors. We've got to get them off of smoking, control their cholesterol, start a walking program, all of these things. And in addition to that, we have to cushion the feet. And, it takes a whole team to treat limb salvage. These people come in and they're sick. Often they're far too sick for any kind of surgical procedure. But I can't tell you how many patients that we've worked on that we've been able to go into a cath lab and come out an hour later via a needle stick with restored blood flow to the legs. Now, to be fair, there's a higher likelihood of a blockage coming back in the peripheral space. But I've had many, many, many patients who've had one procedure and 13 or 14 or even 15 years later are okay. And this is really fulfilling. And I think we're on the verge. I think we're getting closer to having very durable results in the legs as we develop more tools, better drug-coated balloons, better stent designs that won't fracture, that have greater force, perhaps biologics in the future, so that when we put some of these things in, there's better healing. And it's like anything in medicine. When the first bypass was done, it was not as good as it ultimately became. When the first stents came out, results were not as good as they are. This is a process in evolution. And we've been working pretty hard, as you know, to help that evolutionary process. We think about this a lot. We meet with engineers. Sometimes we draw up designs that we think might help. But mostly this inspiration comes from our patients. And certainly when we fail, and sometimes we do fail, particularly in very, very long blockages, particularly if people may have had a whole lot of procedures first where there are false tracks in the vessel. But that's becoming rarer and rarer in today's world. In fact, the overwhelming majority of these patients, we succeed. But we can still do so much better. I'm certain of that. And we must bring the kind of attention to peripheral arterial disease that we have for breast cancer. Far more women die, far more, die from complications of peripheral arterial disease than breast cancer. Now, I'm not suggesting we should not be doing all the things that the Komen Foundation has
Right.
done for women with cancer. They've made a big difference. They've affected this. We need to do the same for peripheral arterial disease. People know about the heart. People think a little bit about strokes and the arteries to the brain, but the legs, they don't even believe they can get the disease, and particularly women. And yet it's actually slightly more common in women than men. That was historically thought not to be the case, but that is true. And women are being amputated left and right. We can do a better job. And we've been poor advocates about this disease, in my opinion, and our societies have been poor. And I've been screaming that for years. And I think we're making headway right now with that.
I think so too. One of the things I wanted to point out about your conference when you began that, it was I won't say controversial, but it was different because you included all the specialties that would have anything to do with it. And I'm telling you, prior to the beginning of your conference, it was rare. It was even to have cardiologists, radiologists, podiatrists, endocrinologists. I mean, all the different specialties, uh, nurse practitioners. I mean, you welcomed cardiovascular surgeons, vascular surgeons, everybody to the table to impact this in a global sense, because it takes everybody to have success. We even had pain management physicians come and speak that talked about uh, you know therapies that they would give that actually increase blood flow to the legs. And I still think there's a lot of work that could be done in that area,
For sure.
but we're not there yet, but man, the progress that's been made over the last 25, 30 years, not just in equipment, but in mindset. So
Sure.
I think you've had a real big impact on that. And I look back, one other question we didn't talk about this before the podcast, but I would just, in your mind, I mean, I'm just curious. I mean, with all the hands-on courses and observational courses, and what number would you put on how many physicians have come through?
Sure.
Because I was heavily involved with it for a
Yeah.
decade, and
So, hands-on training courses I can speak about very easily
Mhm.
because that was approaching 2,000
Oh,
physicians, four at a time. We were doing many of these, but four physicians at a time
right,
and some of their staff. Now, in terms of conference and observational and other, that
yeah,
would be four more.
right,
It was, and a lot of people have gotten interested in this, and we need to keep this interest level going
right,
because I'm certain we're going to do better. For that first conference, we asked everyone to really park egos at the door.
right,
And we thought that was very important because, at one point, you could not go to a meeting with the various disciplines without one discipline screaming at another discipline that
right.
they were the only ones involved in this.
Turf battle.
And our point was, guys, while we're screaming amongst each other, patients are losing their limbs and their lives. And
Right.
that's absolutely not acceptable. And I think we really set a stage for a collaborative meeting. And now, every year, people come to those meetings and egos are parked at the door.
Mhm.
We talk about our failures and maybe how we could get around those. We come up with new ideas. And I must say, at every one of those meetings, you see a bunch of people coming up to each other, giving hugs, because it's become almost a fraternity, if you would, of people trying to make a difference. I
Right.
feel very good about what's happened with the conference.
Absolutely. And you can learn from each other. I mean, uh, podiatrists bring a lot to the table in terms
For
of,
sure.
I mean, if you've got somebody with a blockage down to the foot and you're dealing with an ulcer or something that's healing, and, there's the people that specialize in wound healing and, all this, it just takes everybody to make this thing successful.
It does. It takes endocrinologists. It
Right.
takes surgeons because surgery still is a very viable option that
Absolutely.
helps many people.
Mhm.
It takes people that can treat infections.
Right.
It takes people that can unload vessels. Um, just so many disciplines. Neurologists to make sure
Mhm.
we can check sensations. But once we can do all of those things together, we can make a difference. And I think we can really lessen the scourge of amputation for ischemic disease. we already have in our region.
Mm-hmm.
Certainly that is something I track very carefully when I look at Medicare statistics, but it's not as low as I want it.
Right.
I really
Right.
would love to see no such thing as an amputation from ischemic disease. And we're not there yet, but it is something that we're working on and trying to get better.
Well, again, congratulations on this outstanding recognition of what I look at as a lifetime of work. I mean, it's from the first day we walked in and I met you. I mean, you were doing a heart cath, and I think you were placing a stent. This was back in 1989. Never even seen it. Worked for the company that would go on to develop them. I didn't even know what it was. But we've both come a long way, and you've certainly made a huge impact on this space. And if we've got people out there listening to this podcast, and you know someone that's having issues, certainly get them to someone that's trained to address these issues. And I mean, you can certainly get a hold of Dr. Walker and his group. I mean, they've got a huge footprint, and he's all of his colleagues are trained under his watch, and they can certainly take care of your problems and at least get you on the right track. So I just wanted to have a special edition today to talk about this great award, and I think we've only scratched the surface. There's a much more detailed outline of all of this on a YouTube video that was done on behalf of Dr. Walker and his great group that he's founded. 86 or more cardiologists, all trained in these techniques, and a huge footprint across the South and all the way up into the Midwest. So anyway, be sure and like and follow us on the various platforms. That way you get new notifications as we drop more content. We're trying to get one a week out, but it has been a little bit sporadic because he's got a big travel schedule, and I like to go fishing every once in a while. So anyway, we're pretty consistent. This is number 18. Dr. Walker, I can't thank you enough. And again, congratulations on this Global Impact Award for critical limb ischemia.
Thank you, Terry.
You bet.
Thanks for listening, and please subscribe, like, and share this podcast with your friends and family. Join us next week for new topics and answers with Dr. Craig Walker and Terry Roberts on Cardiovascular Matters.